This is the anatomical position of the temporal bone. How this is anatomical position? The zygomatic process of the temporal bone lies outward horizontally and the petrous part lies medially, anteromedially position. And the superior border or upper surface or upper border of the squamous part is sharp. That's why this is the anatomical position. Temporal bone has two parts. One is the squamous part, one is the petrous part, pyramidal shape. This is known as the suprametal triangle, which is anterior border by the Henle, spine of Henle. So is the spinal body or suprametal spine bolte hai. This is the suprametal triangle. The borders of the suprametal triangle formed by the posterior border of the internal acoustic meatus, superior posterior border of the internal acoustic meatus, which is known as the spine of the Henle. And this is the superior border, which is formed by the mastoid crest, and the inferior border, posterior border is formed by the imaginary tangent line drawn from the inferior posterior border of the external acoustic meatus. This is from the triangle known as the suprametal triangle. Now we are coming to the mastoid part. This is the mastoid part of the temporal bone. On the mastoid part of the temporal bone, there is the sternocleidomastoid attachment is happen. Behind the posterior side of the mastoid part, we have digastric fossa where a posterior belly of digastric muscle lodges.
Posterior
belly of the digastric muscle attached.
Where?
Here. Origin. Attachment.
At this point.
Yes. Fossa. We have styloid process present on the inferior surface. We have the styloid process. In the styloid process, there are two ligaments, three muscles present. The two ligaments are stylohyoid ligament, stylomandibular ligament, and three muscles are stylohyoid muscle, styloglossus muscle, stylopharyngeus muscle. These are the three muscles. On the inferior surface, at the base of the zygomatic process of the temporal bone, we have another fossa known as the mandibular fossa, which has two parts. One is the articular part of the mandibular fossa and non-articular part, which is called the tympanic plate. In between articular part of the mandibular fossa and tympanic plate, we call a suture present, a fissure present here, known as the petrotympanic fissure or squamotympanic fissure, from where chorda tympani passes through, which is a branch of facial nerve. It provides nerve supply to anterior two-thirds of the tongue. The squamous part. On the internal surface, I have told this is the gyri of the lobe of the cerebrum, which from cerebral lobe, which forms this internal surface irregular shape, rough shape. There is presence of the middle temporal artery. Middle temporal artery, which is also known as the middle meningeal artery, which divides into anterior to posterior part and goes to parietal bone. Now we are coming to the important pyramidal structure known as the petrous part of the temporal bone. It has base and apex. Base forms by the squamous part and the mastoid part. This is the base. This is the apex up to foramen lacerum. Now we are coming how many surface and borders it has. It has three surface, three borders. Surfaces are anterior surface, posterior surface, and inferior surface. It has border, superior border, anterior border, posterior border. Now what are the things present here? On the anterior surface, at the near apex, we have the carotid canal present. Above the carotid canal, we have the acoustic eminence present here, arcuate eminence present here. Below the arcuate eminence, we have medially a fissure for the greater petrosal nerve, laterally fissure for the lateral petrosal nerve. Now we are coming to the posterior surface. Posterior surface of the petrous part, we have the opening for the internal acoustic meatus, and behind is the subarcuate space. And behind the petrous part or posterior to the petrous part, we have a group for sigmoid sinus, which goes to the jugular foramen and become the internal jugular vein. This is all about temporal bone.
हो गया
नहीं बहुत कम है।
और बता दी थोड़ा सा कम